Hello everyone, this is Dr. Ali, and today we're going to talk about the medications in ADHD. As a parent, I would want to know what medications are being given to my child. What are the side effects of these medications? How can I track if these medications are working or if they are not working? Do I really have to give these meds? There are three different families of medications for ADHD. There are the stimulants, there are the non-stimulants, and then there are the second-line non-stimulants. When we talk about the stimulants, these are the most effective in treating the ADHD. Because they're the most effective, they're the most commonly prescribed. These are the medications that belong to amphetamine like Adderall and Vyvanse, or the medications that belong to the methylphenidate like Ritalin and Concerta. One common question: if my child is hyperactive, why are you giving a stimulant? Which is a very good question. If you think about it, the cells in the brain communicate with each other using chemical neurotransmitter, which is a signal to communicate. Stimulant medication improves the communication between these cells by making the neurotransmitters more available. If you Google the meds for ADHD, there will be a lot of medications. As a parent, the main difference between these stimulant medications is the duration the medication works. There will be short acting or immediate acting, which means that the medication will last for 4 hours after you give it. And because it lasts for a short period of time, if your child is on a short acting medication, then you would expect that your child will be on more than one dose a day, 2 to 3 times a day. Some parents do not like this, so they prefer the long acting. The long acting, on the other hand, lasts for 10 to 12 hours, so they give one in the morning and then you're good throughout the day to the evening. One thing about medications in general is that they are not curative. So they address the symptoms, they make them better, they improve functioning, they improve the concentration, which would make other behavioral treatments even work better. What are the side effects? The good thing is that the side effects of these meds are short-lived. They tend to occur early in the treatment process, and they're usually mild. So stimulant meds do not build up in your body, which means that if you stop the medication, the side effect will end. One of the most common side effects that you want to look for when you start your child on an ADHD med is loss of weight. It is very expected that your child will lose at least 5 pounds within the first 6 months. That's normal, that's expected, and it's not worrisome because it decreases the appetite. How can we address that? If you are giving a long-acting medication, that maybe you can delay the time of dinner so that the effect of medication will be wearing off and your child will have a better appetite at the time of dinner. Or if you want him to eat better at lunch, then your doctor might prescribe a short-acting med in the morning. That way, by the time the lunch time comes, then they will have better appetite because the effect of the medication will be waning. Always make sure to give a high caloric, dense breakfast. So you would give oats, cereal, frozen yogurt, or eggs. All of these are rich in calories. Other side effect that we want to speak about is loss of sleep. Usually kids with ADHD have insomnia with or without medications, but it tends to get worse with medications. So one of the things you want to do is encourage good sleep habits. So you want to ask your child to sleep at the same time every night. You limit the nap time to 45 minutes, no caffeine, no screen time before bedtime. And then it all comes to the duration of action of the medication. So you might want to give the stimulant earlier in the day, so at night the effect will have lasted and they can sleep better. Or you can stop the evening or afternoon dose, or you can give a short-acting medication so by the time sleep comes, the medication is out of their system. If you really like your current routine, then one of the things you can do is you can speak to your doctor about a low-dose melatonin or clonidine that can help them sleep. What if your child complains of dizziness or heart pounding or palpitations? What do you need to do? Stop the medication immediately and check with your practitioner. What your practitioner will want to do is to make sure that the heart is okay and there's no underlying condition. And if the heart is okay, then you need to make sure to give your child plenty of fluids during the day, make sure they are hydrated, give them midday snack. Another solution that may work and decrease the dizziness is switching from short-acting to a long-acting medication. Some parents ask me, does ADHD meds affect growth? And it does affect the height. So that's why you want to measure the height and the weight every 6 months. But one of the things that you can do is that you can talk to your practitioner and ask about medication holiday. So maybe you don't want to give the medication during summertime or during the weekend, and in that way it does not affect the height. Stomach pains is another side effect of the ADHD meds, and we usually can get away with that if you give the medication with breakfast or if you give an antacid with it. Other stuff that the parents complain of is moodiness or irritability. Usually at the time your child is due for the medication, the appetite suppression effect is waning, and so they are a little bit hungry, what we call hangry. And so what you can do is just give them a snack before the anticipated time that they would get moody because they are hungry. Another side effect is like they get very unusually quiet. It's the zombie phase, but this usually is reversed once you stop the medication. They can develop some tics, just repetitive movement like repetitive eye blinking or shoulder shrugging. And again, this stops by stopping the medication. How to talk to your kids about medications. You want to tell your kids that this is not a smart pill, but it will help you pay attention so you can show the world how smart you really are. This is not a good behavioral pill, but it will give you the chance to stop, think, and make better choices. And that's really important because the more you talk to your kid about medications, they will be more compliant with taking it. Another myth is that if you give your child stimulant medications when they are younger, then they are at increased risk of stimulant use and illegal drug use. That is a total myth. In fact, studies have shown that kids who have started stimulants earlier and for a longer period of time are at decreased risk of caffeine and illegal drug use. So now we are going to talk about non-stimulant meds. That's the second family. When do you use the second family? We use it when your child is not responsive to the stimulant medications, or your child is having too many side effects that he can't tolerate. Usually the second family are less effective in the treatment of ADHD, but they can treat the ADHD throughout the day with minimal side effects. So a teacher might come and talk to you and tell you, well, I have a lot of ADHD kids and a lot of them are meds. I think your child should be started on meds as soon as possible. You're gonna talk to the teacher and tell her that your pediatrician discussed that there are a lot of things can be done for your child. Meds can be one of them. And if the pediatrician and you as a parent decide to start the meds, then the feedback for the teacher, your feedback will be very helpful in monitoring the effect of this medication. Another concerned relative might say, oh, we all know that ADHD is just the teacher's excuse to medicate all kids so they can get quieter and easier to manage. Well, ADHD is clearly a behavioral problem that has been studied and identified. It is very common and it's also treatable. Well, one of the medication effect is to make them pay attention and better behavior in class. This is one aspect. But more importantly for the medication is that they help the child finish the task. I don't care what your doctor says, there's no way your child should be started on a drug. Notice the word drug here. Drug is not the best way to describe medication because it makes it seem as bad or illegal. And you can answer that by saying that studies have shown that medications tend to have a positive effect on the life of ADHD, just like inhaler for kids with asthma. Another response from a concerned grandparent who would say, well, to me, this looks like depression. Are you sure it's not depression? And here is your answer. Well, it's true that ADHD can mimic depression, but the evaluation that my child had was designated to eliminate that. But it's a continuous process. We're gonna monitor, review the symptoms into adulthood. Your child might be a little bit mad that he's gonna be started on medication. He might say, nothing is wrong with me, my behavior is fine, it's others that cannot handle me. And you can respond by saying that it is truly hard to be signaled out every time and seem arguing about following rules. But now that you have a diagnosis, we can start treatment and we can start turning things around.